The marketing that you all put out in response to the article lacks empathy, and it dismisses the real and harmful experiences of those people that have suffered at the hands of this hospital. You highlighted positive health outcomes while disregarding these experiences, and that's disingenuous, and it also can seem like gaslighting. And so it's like PR moves like this is what continues to fracture the trust of the community that you serve. I don't want to take up a lot of time because I know we're at time, but some of the questions that they're raising are about how are you going to take accountability for our poor health outcomes in our community. I hear people pushing that off and really victim blaming tonight and saying the community should step up and do better. But as one of the people mentioned earlier, that's where nonprofit dollars come in. Your community benefit dollars can be spent on programs that can help with preventive care, that can help you simply serve the community that you are serving, an African American, predominantly impoverished community. There are solutions that can help with preventive care so that when people do show up to the hospital, they're not as sick. And so we've got to figure that out, because these are real health outcomes. We have some of the highest rates of cancers, diabetes, heart disease, sickle cell in the state, some rival that of Atlanta, right here in Albany in Southwest Georgia. We can't turn a blind eye to that. We cannot just kind of, turn around and try to push that back off on the community when there's something like you all are saying that we all can do to change those health outcomes, but we're not hearing that in the marketing. What we're hearing is a lot of fluff and, oh, we're doing great and everything is awesome, but we're not hearing how you're going to fix these health outcomes. Another question that came up was about doulas and the fact that if a person chooses to have a home birth, their birth is called a dirty birth by Phoebe, and that they're not allowed to have their doulas come with them, or their doulas are being turned away as guests, and that even their doctors, if their doctors aren't in the Phoebe Health Network, that people can only be seen by a generalist that doesn't know them. And so again, Georgia is actually the worst state in the nation for a Black woman to give birth. We're number 50. We're the most dangerous state in America. And so hearing things like this from people that have had these experiences, it's no wonder we're that way. If we're not protecting the rights of mothers to be able to have their babies the way they want in the hospital system, in the communities that they live in. And then the last question that came in from someone was regarding Dr. Parker, which I think was raised in the ProPublica article. I don't expect you to share what happened with him, but the feeling that they left feeling like was if Dr. Parker wasn't safe at Phoebe, there's little hope for them. And what lessons have you learned from the events around his death that will keep what happened to him from happening to the rest of us? And so I think, again, this is about listening, right? This is about learning. This is about having a community conversation and how do we reduce harm. And harm isn't just about our health. It's about our emotional health, our mental health, our physical health. And the things that we heard tonight, I know for me, that really shook my emotional health tonight, to hear some of the things that were said by the doctors tonight. So I just wanted to share that. These were some things that came in to me from folks, but I do want to share, we've got to do better. We deserve better. I want everybody say with me, we deserve better.
We deserve better.
And change starts when we realize what we truly deserve. Thank you.
So appreciate all those questions, and we could certainly address them. I've never heard it called the dirty birth. Is that in a piece of material that comes out of our healthcare system, or somebody's opinion?
That comes from your doctor.
That comes from a doctor?
In your L&D departments and doctors,
Yeah.
That's what they term home births. When they do come to Phoebe,
Yeah.
They call them dirty births.
Yeah, I mean, the thing about Steve Phoebe is, right, we got 6,000 employees, and you try to make sure everybody's on the same page and everybody thinks in a similar way, but they certainly don't, right? And we like to think, right, everybody's a human being, they deserve to be treated with that dignity and with that respect, and that's our goal each and every day. If I could just address the ProPublica, we could talk for a long time about ProPublica and do they said this and here's what we believe the truth to be. But what I would say is that reporter from ProPublica had her mind made up before she ever came to Albany, Georgia. That reporter from ProPublica said, I'm coming to write a story about the heroes, about the doctors and the nurses who are sleeping in their garages for COVID. We want to tell the story about how this community stood up to COVID, not only just the providers, but the community. And they wrote a completely different story. That's their prerogative to do that. What I would tell you is it was very one-sided, and what they chose to do is what I see, this is my opinion, all right, Scott Steiner's, is that someone else, an outsider, in this case, a New Yorker, who will never come back to Albany, Georgia, is telling the narrative of how Albany, Georgia should feel, is telling the community how you should feel. And they're now providing a narrative, as opposed to us, you providing the narrative, and trying to explain what happened 10 years ago, or what happened 20 years ago. I can't do anything about 20 years ago. I can do something about January 28th and going forward, and that's what we're here for, right? To hear and to listen and to improve. But ProPublica, that article, they have no interest in that. That reporter is looking for an award. They're looking for another award. They're not interested in making Albany better. We talked to her many times. She came to this church right here in this room when we had Project Elevation. She saw the magic that was happening, the investment by Phoebe, the investment by our doctors and our nurses who were here on a Saturday, by Pastor Simmons, by his team. Did anybody see that in the article? One word of it? Anybody see a videotape of it? That wasn't the story she was going to tell.
Are you saying it's not true, anything she said?
I'm saying if we really want to have a conversation about what was said, that there's a difference, there's two sides to every coin. That she was saying, just like with Dr. Parker, the illusion that something was done wrong. She gave patient stories, and she said, well, tell us the other side of it. And we said, we're happy to. Here's the release form for the families. Ask the family to sign the release form so we can talk to you about the care. You know how many forms we got back? 0.